All right. You've got some wonky things going on.
Can you see it?
It's just.
Can you see it?
I'm just going to start with the left side of your atlas, almost into the occiput, and then we've got right lower. So
Yeah, right lower. My knee has been, I worked on it yesterday and it feels better, but all of a sudden I was limping yesterday. Yeah.
How many massages you do a day?
5, 6, or 7.
And then she does that 5 times a week or more?
4 or 5, yeah.
We're going to go over here on this high left side, way up in the corner. Chin back for me. I got to get way over here.
Oh, yeah.
Mm-hmm. Yay. Here we go, other side. This one's a little lower. I have to go so dramatically in that corner. Just get it. Is that what you were waiting for?
Hallelujah, yes.
Okay. And this knee. Like right here. Mm-hmm. Look at that. Mm-hmm. I can see it through the stars and the galaxies. They were trying to distract me, but no. So I got a tiger tail. That's what I've been using on people. They're, it's just softer.
Okay.
But some people are like, it's not enough. And some people are saying they want more. Some people can't. This is softer than the roller. But you have a knot right here, and that's bothering your knee. Yeah. So see how this feels. It shouldn't be too bad.
Good. Tickles.
Tickles?
A little bit.
Uh-oh.
Just because it's sensitive, I guess.
Let me try to roll your leg a little bit in, as long as I'm not twisting it. There we go. Is that okay?
Yeah.
No?
It is okay. It's okay.
It's just let me just not roll then. Right in here, that's hurting your knee.
Yeah, I know. That's what I was rubbing on yesterday.
Is it doing better today then?
Yeah, it doesn't. I'm not limping.
Yeah, obviously you weren't limping when you came in. Ah!
Oh.
Sorry, I feel your pain. The legs are the worst. One more. This will really
help.
Give you some mileage on it. There we go. It's almost to the bottom of it.
I was foam rolling.
Yes.
I hadn't lately.
Oh man. It's very common. It comes actually from the low back. Mm-hmm. It radiates down into this, and it creates this little knot.
Okay.
It's I can't remember what it's called. The chemical that the nerve emits. It's in the nerve actually.
Huh.
And it acetylcholine, I can't remember now. It basically just seeps into here. Yes. And it'll build up, and the knee will contract. The calf. Oh my God. The thigh. Where are we? The thigh will contract, pull the knee cap up, and then it won't track correctly. And that's why I always check you guys. In my videos, I'll take the knee and check. And it's fine. It's free. And if I want an extra check, I come into the fibula and check. It hits ground. For lack of a better word, it closes. So I'm not too worried about it. When it's kind of gaping and it's squishy, then I'm more worried about the knee.
Yeah, I wasn't sure if it was coming from my foot or my...
We can check it. That's not...
Because that started first.
The foot?
That old feeling of like it feels swollen, but it's not. And you're the one that helped me with that last time.
Oh, we just get it. Ooh, that was a good one. Couldn't hear it, but it just goes. And then you're saying mostly it's neck and shoulders. Those are your biggest ones, or is it the knee that's your biggest?
Well, the knee, like I said, I think
you got it.
Hope for it. I just need to be diligent and stretch that area.
Toes. Okay. Ooh. It's good for proprioception, spatial awareness. Your cerebellum needs to know where you are in space.
Yes. My cerebellum needs help.
Yeah, mine too. Look at that. This side has way more flexibility, though.
Yeah.
Yeah, this side is loose, and the other side is tight. Do you notice that you are more flexible on the left side? Like in yoga? Or?
I was just walking around asking myself that question yesterday.
It's just when I adjust you, this is the more difficult side to adjust.
Yeah. My left glutes feel inflamed, and my left QL
Okay, well let's get.
But I know you can't do it all. I get it.
No. Let's do those. I'm gonna touch on them. We're gonna go on your stomach, face down. I can work quicker. Okay, yeah, I feel this cute all here. Look at that. Ooh.
But I have been laying on the foam roller.
Okay, good.
And I also have a pillow in my car that I put right, at my bra line, and it really helps.
Oh yeah, anytime you can take the tension out of here.
Yeah, I mean my low back pain immediately goes away when I keep that up.
And like, how long has it been since I worked on you?
Several months, like I would say 4.
Yeah, it's time. You need it again. Your neck, I finally cleared out. That took me a little bit there, but that finally let go.
So I'm gonna be able to think better now.
Maybe. Something. Your balance, I would think, would be the most affected by it. It's like I have to be careful what I say on here. Oh no, the chiropractor said that they treat mental problems. Jeez. Oh. There you go.
I find when I'm on my cycle too, I get inflamed.
Yeah, everything is, right?
Especially that, like my
Yeah, I told you, it's been a while. I was gonna start out with the green roller and I went, nope. It's too swollen, I'll kill you with that thing. It's I know you're doing all the stuff for it, it's leaning forward in your work, like what I do here. I'm always trying to prevent it. Now I'm actually relaxing in this position.
Yeah.
I know you're not, but because my elbow's in your back. But this is actually no pressure on my low back. Whereas what I was doing before, I felt pressure.
Right. See, when I work on my table, it's thinner like this. Not as thin, but so much better than the bigger tables.
Bigger, wider ones, yeah.
And they just made them wider.
Well, I got a wide massage table. It was killing my back.
Yeah, I literally
But my patients loved it, but I'm dying here.
Yep.
Yeah, because you're having to, on a wider table, your patient or your client is here, and you're having to lean over further to get to them.
Yep.
So the thinner the table, the more I can get. I rest my legs up against the side of the table here, and I just lean in. No pressure on my low back this way. I think I've torn this thing apart as much as it's going to be able to take without getting irritated. But see that? There's some scar tissue right here. You can take a tennis ball or baseball and work on this.
I used to ride horses. Fell off a couple times.
That'll do it to you. Yeah, it's just right here. It's an odd place to have it. So that's why I'm like, yeah, it's an injury too. Like you usually find stuff here. You know what I mean? Here, here, you find injuries, but this is an odd spot. It's not terrible. It's just that's going to be hard for you to bring your torso back over your pelvis when you've got this little chink here in the chain. So we got to mash that up. Ooh, sorry, that had to...
Feels good though.
Yeah, you gotta mash on that. One more. Right there. I'm coming for you.
It feels excellent though.
Here we go. You ready?
Yeah.
I know I kick whenever I have this done. I'm always like, oh God. But I'm like, no, keep going. Jeez. I can't do the paper towels. They're messing me up. Here we go. I was trying to protect your.
It's fine. Don't
shirt.
even. This is like such an old shirt.
Okay. I was trying to protect it from the oil, and I'm like, no, I gotta get underneath there. Too much? You gotta let me know.
No, it's fine. I have a pretty high tolerance.
Yes, you do. Yes, you do. I got a new massage star I could try out on you. It's kind of like a hot stone. It's not hot.
Oh, really?
I kind of like it.
What is it?
It's like $17. It's kind of like your stone.
Yeah.
You know, but it's just got an angle on it.
I have one stone like that.
Oh.
That I actually found, and it's like a triangle.
Wow. Yeah. It's just, it helps my hands. Like when my thumbs get tired, I can kind of come in here, go like that, and that's how that feels. Don't pull on your hair. I'm sorry.
That's fine.
It's been saving me a lot.
Oh yeah, I bet.
You can kind of use it on yourself too.
Yeah. I have one of those hooks.
The canes.
Yeah, the canes.
Yes, I do too.
I used to carry it in my car.
I always tell people, go watch my video on how to use it. Because people buy one, they're like, I don't know how to do it. It's easy. You know, you would push down on this and pull that hook around.
Sometimes I lay on the rocks, like at the trigger point areas.
There you go, yeah.
Not lately.
Saving it up for me.
Yeah, I saved it all for you. No, I started stretching yesterday. I'm like, I need to get in shape before I go see her. I don't want to be too erect.
There we go. I know it's like going to the dentist. I better brush my teeth before I go.
Make extra floss.
Yeah.
Yeah. Clean your house before the cleaner comes.
Yeah,
all that good stuff. Which I've never done, but.
There we go. I hear little Lachlan out there.
Oh, yeah.
Baby. My husband's like, don't you want to take him from the, I'm like, he's a part of this channel at this point, too.
Yeah.
He'll come in and say hi,
He's so cute.
Like, this is a family practice. I've got my kids here. There we go. Woo! That busted that up pretty quickly. Okay, other side. Some oil down. Because, yeah, this is pretty bad right here.
Like dairy, like is like insane. I have one piece of cheese and like I feel like I have bronchitis that night. It's bizarre.
Oh wow.
And then the next day it'll be fine. And it's the weather and the pollen and
yeah, that too. All right, I'm gonna check everything now. You're not too many scars. Up here, it's just tension. There's not that big heavy scar tissue load up here. I can check underneath the scapula, but I don't think there's much. No, there's nothing over here. This one maybe a tiny bit more.
I can feel that little crack right there.
Yeah, so then I'll come in here with the star again. And just pull down and go under there. Okay, if I'm going too hard, you let me know.
Okay. It's fine. it's weird. I have, you know, my QL is so tight on this side.
Mm-hmm.
But I feel like when I walk, my right side of my hip is higher.
The right side of your hip is more it's translated to the right. This is why your knee hurts.
Mm-hmm.
Oh, man. You're right. This QL is so hypertonic, and then this over here is as well. It's common. They call it lower cross syndrome, for like to be tight here and then cross over to the right.
Gotcha.
There you go. Get it one more. One more on the exhale. It's right in here. Here we go again. I might not be able to show this. It's just right there. Yay. It's into the side here. Hey, there we go. There we go. That's it. I found another one.
Oh, great.
I don't know. It's really, really low, though. I'm going to have to use the roller. Feel it right there. Right there. Right there. Just come on. Any pain down your leg or anything? Okay. Good. It's really tight in there. Good. Again. These are the ones that are sore. Deep breath in again. Oh, yeah. Good. All right, bottom leg straight. Yep. Let me see what's going on here. So let's take this one. There you go. You remember this one? Yeah. And then I've got you here because I want you to go back. Oh, I think it almost. This arm comes here, but your body. So almost like off the table. Yes, there we go. I got you. Let the leg go. It's okay. Yep.
Oh. The traumatized adjustment I had with this position kind of traumatized me.
I know. I had somebody contact me the other day. They're like, I've been sore for 3 weeks after I visited to the chiropractor, and I'm like,
and I told you I was like blacked out because he kept trying. Yeah, so that's why I know I hold on a little bit.
No, I'm far away.
I trust you,
but
I trust you.
But that's why we go all the way back. That protects the spine. Very hard to injure the spine this way. It's when you have the person in flexion, it's not a good move. I don't believe in that move. So I'm right here on the sacrum, this huge joint down here.
A little bit.
That's all it needs, though. It's not like you need to go.
Yeah.
Unless it needs it. In your case,
and then it'll do it.
It'll do it,
yeah.
Right? What else did I want to do? How's it feeling? Oh, the leg. The leg is what I wanted to do. Right here. Just roll on this one.
Yeah.
Is that sore?
Mm-mm.
Yeah, I know you foam roll everything out, so. And you go down the leg. Because the nerves can get trapped in here.
Yeah, that's where I feel it stemming from.
Right there.
Mm-hmm.
Diego. Blarg, blarg, blarg. That's when he's losing in a video game.
Oh.
Jeez. Oh my god. Blarg, blarg, blarg. Relax, Diego.
That's hilarious.
That part that I couldn't get. Right where this galaxy is. Right here. Somehow I can see it through the galaxy that there's a knot right here.
Mm-hmm.
Right.
I can feel it.
Yeah, so this is where the numbness is coming from.
So I've had that knot for 20 years.
Yeah, pretty much. Knots, you have to keep flattening them out.
Yeah.
They just want to build back up again. So that's why we have professions.
Yeah.
Because that's all we do is flatten this stuff out. There we go. Ugh. Ugh. And then when it kind of lets go and it starts to roll, then I usually stop. That's usually enough for the person. How does it, like, just do a check? It's like everything good.
I feel so much loose.
Your neck. That was like my biggest achievement.
Well, the back of my ear was sore from it. Oh, I have one question. I've been having this weird thing where this muscle right here, I don't even know, it's kind of like right here.
Okay.
It's been tensing.
Neck, right in here.
So
You just basically, you know how to do it. This muscle here is the temporalis muscle, right? Right in here.
Mhm.
So is it like when you clench, you feel it?
it's more like in my jaw, like
Oh, okay. So,
up between my temporalis or whatever.
so I just usually just take my hands like this and just drag,
Just drag down.
like right on the jaw.
It's bizarre when I drink something.
It happens.
Mm-hmm. And it's like,
Let me see if I find anything.
and the tingles too. Like, I think that was from my neck being so out.
What happens is when your head is forward like it was, it just pulls on the jaw.
Everything. Yeah.
Yeah, and your neck was, I haven't seen your neck quite that bad in a while. A trigger point almost. Back underneath right here, and that could be very well be leading into your jaw.
Okay. Like just wound up.
Yeah, I really had to work on that.
There, yeah, I've been looking at the. I'm very interested in the like structural integration. Ida Rolf.
And
Like Rolfing, you know.
Yes,
Rolfing?
Rolfing, yes.
Well, she's the lady that.
Invented it.
Yeah.
Or,
So I was watching videos, and I didn't know this, but I guess when like back in the day when doctors were studying to be doctors working on cadavers, they would cut the fascia away. I find that so interesting.
because they wanted to get down into it.
Yeah, but like that whole structure is so
Connective tissue,
important.
yeah.
I'm like, wow,
I didn't do the scraping on you.
that's fine.
You're like, I don't need the bruises. But you need some kind of superficial work. Because
Okay.
you've got a little bit.
Okay.
The only place I found it, I believe it was over here on the top.
Yes.
That was it.
Thank you.
All right. Okay. Aw.